Good morning. Welcome to the Community Voice. I'm Steve Gradick, your host. Delighted to have you with us on this beautiful Monday morning. And our program is brought to you by Tanner Health System at Oak Mountain Academy. We're grateful for their sponsorship. We're very honored to have in the studio today Marcy Heath of Insurance Solutions of the South at Innovative Benefits Consulting. Phone number is 770-537-5300. We now have been doing the program for over a decade.
Yes.
Every year you come in. You and I raised the red flag before Obamacare was Obamacare. Nobody listened to us, and it was voted in. And then when the Republicans got houses in the presidency, it wasn't voted out. So nobody listens to us. But today we know they will because you've got a lot of great information. And we want to start off. It's called the Marketplace, but I referenced Obamacare. That's basically where you can buy insurance now. And the open enrollment for individual and family runs from Wednesday this week through December 15th. So tell us about when someone's looking at open enrollment, I mean, not only what it means, but what's new about it for 2024 and what should people know?
So you are right. It is Marketplace. Although it did get the name Obamacare just because the ACA was passed during the Obama administration. Of course, you've got November the 1st through December the 15th if you want a January the 1st effective date. However, open enrollment does run from November the 1st until January the 15th. Okay, so if you do not do anything by December the 15th and you prolong it, let's say you come in on January the 10th, then you'll have a February the 1st effective date.
So what's in my eyes going to roll in the back of my head halfway through this program, so don't let that scare you. Tell us, I mean, this is really almost a whole science about what the options are, what you need to know, what you need to do. And so this is 2023 now. We talked about over a decade, but things have changed. And so what's new for 2024 in terms of what people really need to know?
So as far as 2024, look to see rates increase. I think they're averaging about 5 to 7%. You still have access to the premium tax credit. Of course, you have to, be within the federal poverty guidelines. Of course, that increases every single year. So I remember when I first started Obamacare Marketplace coverage, I think it was like 2014 when the Marketplace opened. Your average income for a single person was like, I don't know, $8,000. So that's the lowest that they could make in order to get a premium tax credit. Well, now for an individual, of course, the federal poverty level increases every year. So now it's like $14,000 that an individual must make in order to qualify for a premium tax credit.
Well, we use the term
ACA, Affordable Care Act.
And then we use the term Marketplace, and I'd use the term
Obamacare.
Which is the most prevalent term used among insurance companies like yourself? Is there one? Everybody just kind of uses whatever they're comfortable with.
Right. So you really, a lot of people don't really know or understand ACA. So most people reference it. Most clients reference it as Obamacare. Some reference it as Marketplace, but your carriers, like insurance carriers, it's Marketplace.
One of the big topics, you mentioned carriers, that we discussed over the years has been the actual coverage and carriers. And where are we in West Georgia now?
So West Georgia, if you live in Haralson and Carroll County, you have Alliant, Blue Cross and Blue Shield, and I think Embeddor is offered through the Marketplace, but Tanner does not take Embeddor. So if you use Tanner, then you've got access to two carriers this year. It's Alliant and Blue Cross and Blue Shield.
So it was Blue Cross Blue Shield for several years.
For several years it was only Blue Cross and Blue Shield, and so they have now added Alliant.
Okay, well, I would assume that's a positive.
That is a very positive move. Although Blue Cross and Blue Shield holds the majority of our clients, I tend to like Alliant a little bit better. It's a little bit more expensive than Blue Cross and Blue Shield. However, their coverage to me is a lot better.
Mm-hmm. Tell us about. It seems like when most average people talk about insurance, nobody knows the depths of insurance, and nobody wants to. I certainly don't. Of what you know about insurance policies, but one thing people I think in generally do talk about is deductibles.
Yes.
How much out of my own pocket am I going to have to pay? I got to pay, et cetera, et cetera. Where are we now on deductibles when we talk about whether Blue Cross Blue Shield or Alliance or whatever? Mm-hmm. What's the story on deductibles these years?
So as far as so the marketplace is a little tricky. So it depends on where you fall in the income guidelines. If you fall within a certain range of the guidelines, then you get extra help. And when I say extra help, that means that basically, like if you're looking at a $5,000 deductible, it might reduce it down to $2,500. So there is the extra help that's offered within the marketplace. However, you've got to be in that income range to be able to have access to that. I would say outside of the marketplace, like if you didn't want anything to do with Obamacare, we do have individual plans that we sell, that's not tied to income, that's not tied to taxes, and you're looking at deductibles of like $3,500, $5,000. Of course, the higher the deductible is, the lower the monthly cost is. But I was reading an article, and you talk about deductibles. Well, the out-of-pocket maximum is a big thing because during the ACA, one of the things about the ACA is like every single year your total max out-of-pocket increases. So in 2014 you had a total max out-of-pocket of say $6,500. Well, over the years, as that's increased, now you're looking at a total max out-of-pocket of, I think it's like $9,200 for an individual. And that's across the individual spectrum and then also the group, which to me is a little ridiculous. If you've got an employee or an individual, that has a $9,200 max out-of-pocket and their minimum wage, and they had a catastrophic event, that would be devastating to them. I mean, the national average, if you look at how much money people have in savings, to be able to pay a $10,000. I mean, most people don't even have $1,000 in savings, especially with the way the economy is right now.
There's a lot I don't understand, and anybody who knows me knows that. But you're talking about, we used to talk about catastrophic deductibles as being around $2,500 or $3,000. Mm-hmm. Now you're talking $8,000, $9,000. Mm-hmm. What in the heck happened?
The Affordable Care Act is exactly what happened.
I mean, that's just appalling. Mm-hmm. I mean, that's just appalling. But now, if I heard you correctly, you're talking about businesses that still offer health insurance. The deductibles still being that high. You're not talking about just individual policies.
Mm-hmm.
You're talking
about
both.
It's across the board.
Really?
Yes. And that's one of the things that I'm very proud of. We pride ourselves in, looking at the, the best plan for the employees, because $9,100 or $9,200 is devastating. So, so we try our very best, within reason of cost, to keep the max out-of-pockets down. Because on the group side, you can at least, try to offer something less than the $9,200. But the average is $90, and especially on your fully insured plans. you don't have the option to be able to, to modify those plans. So if you buy a plan that's fully insured on the group market, $9,200 is basically what you're looking at as the max out of pocket.
What we hear, I know you've done in the past work with local governments, but we hear about, the government health insurance plan is the best of the best. What is that not true?
No. So I was working with somebody last week that is on the state health benefit plan. No. They offer I think it's like a gold, silver, bronze plan. Yeah, from what I saw, it was not the best of coverage.
I've never really, talk about all the things I don't understand. One of them is I don't really understand co-pays and co-insurance. How would you describe that for somebody like me that doesn't fully understand?
Okay. So a copay is basically your first dollar benefits. So normally plans have a copay for your primary care physicians and your specialist. For an example, primary doctor copay might be $15 or $20, and then your specialist is usually a little bit higher, say $30, $40. And that goes along with your RX copays. So as far as your prescription drugs, you've got different copays for different levels. You've got tier 1 through tier 4, tier 1 being generic.
Are they starting to go out of sight? Not so much.
Not so much. Your specialty medication is really expensive right now. But you've got a lot of the generics that falls in tier 1, and some carriers offer that for a zero copay.
Is co-insurance then like a supplemental?
No. So your copays is your first dollar benefits, and you do not have to meet your deductible or co-insurance in order to use those benefits. Okay, so that's why we call those first dollar benefits. Your deductible is basically your major medical deductible. So anything that falls in major medical, such as surgeries, in and outpatient hospital stays, diagnostic, blood work that's not preventative, MRIs, CAT scan, all of that is considered major medical, so that's going to go towards your deductible. Now, one of the good things that happened during the ACA is that they made the total max out of pocket to where every time you go to the doctor and you pay a copay, like everything that you do within your plan and everything that you pay goes towards your max out of pocket. Did that make sense?
Yeah, I got it. Clear as the bell. All right, we're going to take a break. We're going to be back and talk more about the Marketplace open enrollment for individuals and families, and we'll probably get a little bit into Medicare as time goes on, but we'll be back with Marcy Heath, Insurance Solutions of the South, and Innovative Benefits Consulting. But first, these words from Tanner Health System and Oak Mountain Academy.
Oak Mountain Academy is an innovative school of academic excellence celebrating over 61 years. I'm Patrick Uran, head of school, inviting you to join us on the mountain to see our mission and vision in action. Academic excellence, a faith-based environment, and dynamic opportunities are just a few of the reasons our families choose Oak Mountain Academy. Academic scholarships and tuition assistance are available. For more information, visit us at oakmountain.us. Discover your journey at OMA. Prepare, explore, and achieve.
Health is a journey. It's making better choices, even when it's not easy. It's taking care of yourself and the people you love. At Tanner Health System, we're there for you with every step, with primary care, heart care, cancer care, women's care, orthopedics, surgical services, and so much more. We're dedicated to helping you live and feel your best. So let's get on that journey to health. You've got places to be for many years to come. Find us at tanner.org.
Good morning. Welcome back to Community Voice. I'm Steve Gredick, your host. We've got Marcy Heath in studio, Insurance Solutions of the South, Innovative Benefits Consulting. Now, at the beginning of the program, you ran through this real quickly. And, for those of us who are a little bit older, You need to slow it down. When it's open enrollment, and explain to us again the extension, I think you said into January.
Yes. So November the 1st, which is Wednesday, is the open enrollment beginning date. If you want a January the 1st effective date, then December the 15th is going to be the cutoff date. Now, they did extend it. It's been extended, I think, for the last 2 years or 3 years. They extended it to January the 15th just to allow people more time because, you're right at the holidays of Thanksgiving, Christmas, and, so I don't know that that's the reason why they allowed more time, but they did extend it to January the 15th.
But can you sign up for a health plan outside of that open enrollment? Mm-hmm. Well, that doesn't make a bit of sense.
So okay. So we do have plans that you can sign up for all during the year.
But they're not part of the marketplace.
They're not part of the marketplace.
Okay, I see.
Right. And so here's the thing is like the marketplace is guaranteed issue. So if you've got cancer, if you have diabetes, no matter what medical condition that you've got, you can come in during open enrollment and there is no pre-existing conditions. Plans that are outside of the marketplace that have nothing to do with Obamacare and premium tax credit subsidies, you can purchase those, but you do have to go through medical underwriting. Mm-hmm. So you've got to pass medical underwriting to be able to have access to those plans.
Mm-hmm. But that precondition issue, that was not completely just rectified by ACA, was it? Mm-hmm. It was. That took care of that across the board. Mm-hmm. But there were still places you could get insurance with pre-existing prior to ACA. Mm-hmm. Mm-hmm. Understand the state of Georgia is going to jump into the game?
They are. So the crazy thing was we got notification, I guess it was around June or July, that Georgia, I think it's called Georgia Access, was going to be up and running, and that we were going to enroll people through Georgia Access, for the 2024 benefit plan year. So went in, took, certifications, got everything done, and then lo and behold, got an email, I guess it was around the 1st of August, that CMS is not going to allow them to do it this year, but they are going to allow them to do it next year. So in 2024, we will have a lot more to talk about because we will not be a part of the federal marketplace anymore. Georgia's going to have its own state-based exchange, which will operate like the marketplace, the federal exchange, but it's just going to be, it'll be Georgia Access. It'll be Georgia.
So I would assume there are advantages to that.
So I
maybe.
I want to try to be positive and say that yes, there's going to be positive changes. I think, I hope that we'll have access to more carriers. I hope that more carriers will participate in Georgia Access. However, when the Affordable Care Act was passed and Obamacare, came into existence, we were promised if you like your doctor, you can keep your doctor.
I remember that.
And the marketplace was supposed to work kind of like Expedia, to where you could go in and have all these options. Well, before Obamacare, we had probably 10 to 15 individual carriers. Now we have 2. So, I don't know. I guess we'll just have to wait and see.
So, when someone is considering a health plan, what are some of the things we talked a lot over the years about in-network, out-of-network, doctors, mm-hmm. hospitals? What are some of the things you need to know? There's something called a formulary. What are some of the things to consider when considering what health plan works best for you or your family?
So considering that we only have really 2 options, if you go through the marketplace, you've got Blue Cross and Blue Shield and you have Alliant. That's one of the reasons why I like the Alliant plans, is because it is a PPO. You've got Blue Cross and Blue Shield, which is an HMO. So HMOs have 0 out-of-network benefits. Okay, so if you go to a physician or a hospital that's not in network, you have no benefit at all whatsoever. Alliant operates on a PPO. Well, they actually have a PPO and an HMO. Most everybody usually goes with a PPO because it has out-of-network benefits. So if you like going to a physician in Alabama, if you have the Alliant PPO, then you do have out-of-network benefits.
What about when you go to a particular hospital and they really don't have the care that you need for a specialty or something? What happens then?
You have to find somebody that's in network that will offer the care that you need.
How difficult is that?
I
mean, if I got like 5 days to live, I don't want to be go searching around. I just need to go to somewhere. You know what I mean?
So all insurance carriers have, I guess you could call like an advocacy team, to where you can call in and, they'll at least, give you some options of providers that are in network.
Where are we, and then we're going to take our next break real quick. Where are we in terms of the getting reasonable insurance for individual or family, whether through their employer or whatever, in terms of their percentage of their income? Are we bankrupting a lot of people because of this?
So are you talking about the individual or the employer market?
Both.
So on the individual side, of course, I would say probably 80% of my clients go through the marketplace. So they do have, some type of.
But is it breaking their pocketbook or breaking the bank?
Well, of course.
It is?
Of course. But like everything else, I mean, you go to the grocery store and you walk out with 2 bags and you've done spent $250, or you walk into Walmart and you walk out with 1 little bag and you've spent, $95. So
you go to the gas pump and you go, what in the world's going
exactly.
on? All right, our guest this morning is Marcy Heath, Insurance Solutions of the South and Innovative Benefits Consulting, 537-5300, 770-537-5300. Brought to you by Oak Mountain Academy, Tanner Health System. We'll be back with more.
Oak Mountain Academy is an innovative school of academic excellence celebrating over 61 years. I'm Patrick Uran, head of school, inviting you to join us on the mountain to see our mission and vision in action. Academic excellence, a faith-based environment, and dynamic opportunities are just a few of the reasons our families choose Oak Mountain Academy. Academic scholarships and tuition assistance are available. For more information, visit us at oakmountain.us. Discover your journey at OMA. Prepare, explore, and achieve.
Health is a journey. It's making better choices, even when it's not easy. It's taking care of yourself and the people you love. At Tanner Health System, we're there for you with every step, with primary care, heart care, cancer care, women's care, orthopedics, surgical services, and so much more. We're dedicated to helping you live and feel your best. So let's get on that journey to health. You've got places to be for many years to come. Find us at tanner.org.
Good morning. Welcome back to Community Voice. I'm Steve Wright, your host. Delighted to have you with us. We're on Facebook Live if anyone likes to post a question or comment, et cetera, et cetera. One thing before we move on to Medicare, regarding the marketplace, there's something called a mandatory consent form.
Yes.
To what or to whom are you consenting?
Okay, so last year they implemented this in Medicare. Mm-hmm. To where if you are going to, talk to a consumer and sell them a Medicare Advantage plan, you've had to have that documented. So you had to have either, record the phone conversation or, so there was a lot of changes in Medicare last year. Well, they've now brought it down to the individual market. So there are 2 separate, I guess there's a consent form, and we have to have that before we can even talk to a person, to enroll them. So CMS is basically making you get consent, or making us get consent forms, and the client's basically saying, yes, I agree that Insurance Solutions of the South or Marcy Heath can, handle our marketplace coverage. But then you also have another form, and it's basically accuracy. So once we enroll somebody, we have to have a form for them to sign, basically stating that all of the information that we have that we've implemented is correct, along with income and, address, tax dependents, and stuff like that. So there are 2 mandatory forms that we have to get signed. I have my different reasons on why I think that CMS is really trying to regulate this. I mean, you've got a lot of, fly-by-night insurance brokers that have just, or agents that have just, came into the field and, trying to, to get business. We really seen a lot of that during when Medicare Advantage plans first came out. We would meet with clients and we'd sit down with them and, give them the plan and put them in the right plan. And then you would have these insurance agents coming out from Atlanta that would target, certain areas, within communities and, do this fast sales pitch and get somebody on a different Medicare Advantage plan just to get the sale. And then the people that, just got sold never saw this person again. And then 3 months down the road, when it was too late and they couldn't switch their Medicare Advantage plan back, realized that they were in the wrong Medicare Advantage plan.
Is that the reason Advantage plans have gotten a bad rap? In part because of all the marketing and the brouhaha around them.
Yeah, and that's really the kind of frustrating thing for us as brokers is, it's like we are heavily regulated in the Medicare market. Even on, like, if you've seen my email, you'll see down at the bottom, we have to state that we don't offer every single plan, and then we have to give them the Medicare, 1-800 number. But then you see, especially now when you try to watch TV, every other commercial is one of those things trying to sell you, the latest and greatest thing, for zero and extra benefits, but they're not held to the same regulations that we are, it seems.
Now, Medicare annual enrollment period lasts to December 7th.
Yes, so Medicare open enrollment actually started October the 15th, and it runs through December the 7th. So if you have a Medicare supplement or if you have a Medicare Advantage plan, and you want to look at going either way or, maybe switching carriers, now's the time to do that, and you have until December the 7th.
This doesn't impact Medicare supplements, correct?
No. Mm-mm.
Which is a good thing.
Right. Yeah. So Medicare supplements, and that's one of the misconceptions that, the consumers have, is that you have to do everything in the October the 15th through December the 7th. Now, October the 15th through December the 7th does, that's at the time that if you want to switch your Medicare Advantage plan or your drug card, you can do that. Medicare supplements, you can change anytime throughout the year.
And you're heavily regulated.
Mm-hmm.
And radio stations are notoriously, monstrously, totally regulated.
Yes.
All right. Well, Marcy Heath, thank you.
Thank you.
I've learned so much. I understand so little. But anyway, thank you so much for coming in. Marcy Heath of Insurance Solutions of the South, Innovative Benefits Consulting, 770-537-5300. Call Marcy or Dawn and talk to them today. Get your questions answered and learn a lot more. Thank you for coming in.
Thank you. I appreciate it.
We'll do it again next year.
Yes. And we'll have a lot to talk about next year.
Yeah, because Brian Kemp will be in the insurance biz.
Yep.
That'll be fun. Mm-hmm. Okay. Well, anyway, thank you for listening. Go out and make it a great day. You're in tune to WLBB.